When I was diagnosed with lupus, I wasn't the only one affected. My family as a whole was also affected. My name is Juana Mata. I am a healthcare advocate and a lupus patient. Initially, when I was diagnosed, it was very, very difficult to just not only going through the pains and aches, but also emotionally, I wasn't able to cope at one point because I didn't know what lupus was. So it was very difficult for me and my family. So I started learning about the condition, and the more that I learned, the better that I felt, because I knew that although there were no treatments at the time, I knew that with treatment I could feel better.
If you had any lessons learned, how would you have wanted your providers to communicate differently with you, and how would you have communicated differently with them?
The reason I started not only advocating for lupus patients, but for patients overall, to let them know that you have a voice. I'm alive today because I advocated for myself. If I had gone home, like the doctor said, I would not be here today. I'm alive because my self-advocacy helped me, and my persistence and my determination to know what was wrong with me is why I'm here today. In 2009, when I was feeling sick, I didn't know what was wrong with me. I went to the doctor, and after many, many visits and not knowing what was wrong with me, because I was not only having body aches, my hair was falling, I had the butterfly rash on my face, and I had many other symptoms and excruciating pain. I went to the doctor thinking that I need an answer now, because the mouth sores were so bad to the point where you could see like holes inside my mouth. One of my brothers actually said it looked like if I had a tooth extracted. So I go to the doctor. The doctor dismisses me, tells me that I look okay after asking him for lab work. I knew something was wrong with me. I knew that I needed help. So I asked the doctor to get lab work for me, because I thought I had leukemia at the point because of the mouth sores. He dismissed me. He said I looked fine, that I could go home after I get lab work, but I wouldn't get my lab work results until the following day. I insisted, I persisted, and I said that I wasn't going to leave the doctor's office until I knew what was wrong with me. After a struggle of asking about what the lab work would be or the results of the lab, I was sent to the lab again, and to his surprise and my surprise, after he received the results, I was asked to go to his office. I was told my platelets were low. My platelets were low, and I didn't know much about platelet count, but I knew that 99 was low. The normal count of platelets is 130. I asked him what my platelet count was. He had said that they were low, so he didn't really want to tell me at the beginning. But after insisting, he said my platelets were at 6,000. Again, normal is 130,000. I was then rushed to the emergency room, and a few hours later, my platelets had dropped to 2,000. I was then admitted to ICU.
What can people do to really ensure that their voice is heard? You've had that lived experience. Do you have any encouraging words for patients?
What I always say that every patient should do is not only knowing your body, knowing your numbers, but listening to your body. Remember, we are the CEOs of our body, so we know as patients when something is not right. The doctors deserve all the respect. They are the professionals, but we as patients know when something is not right. So definitely listen to your body. Be prepared when you go meet your doctor, because at the end, you're the one that needs to let the doctor know what you're feeling, what your symptoms are, and if you know something is not right, you know when something is not right.
Okay. Barrier breaking communication in healthcare. What does that feel like to a patient, or what do you think that should show up as in healthcare?
A barrier that many of us patients face is not only the culture. I'm Hispanic, and because of my culture, a lot of the times we don't feel comfortable to not agreeing with what the doctor says. So definitely a barrier is to know how to speak to your doctor, to know about you and your condition, to be ready, to be prepared. And that's one of the barriers that I faced, and I believe that a lot of the Hispanic community faces a barrier in communicating with the doctor. What I did to break the barrier of the communication with my doctor is learning about me, how I was feeling, knowing that something was not right, and having the voice to speak to the doctor, and having the knowledge, that knowing that I knew my body was going through something. So definitely just knowing your numbers, knowing your body, understanding your body, and being ready to speak to the doctor is how I broke the barrier to speaking to my provider to get where I am today.